We're very fortunate to have Dennis Stefanacci, President and CEO of the Broward Health Foundation, in our studio today to talk about all the great things that are happening at the foundation. And I feel it's because of you, Dennis, and I know you don't ever like those compliments, but when I go to the board meetings, I see that you have really acquired a great board, and you are so passionate about what you do. Now, is this just your modus operandi? Is that just who you are? Or is it because Broward Health Foundation inspires you?
Oh, no, I think Anita, it's clearly is because of the organization, the mission of the organization, and our ability to, in working with you and other members of the board, really respond to the needs of the community in a very positive way. I get joy every day by engaging in the work of the community and the work of this great healthcare system. And, it's a privilege to serve in the capacity that I do as president and CEO of this foundation, because we have the opportunity in our foundation through our ambassadors like you and other community leaders to really address some of the most important needs of the hospital and to connect donors' wishes through philanthropy to really responding to what these organizations need as they move forward and continue to grow. So for me, the job is fun. It's always been fun. I've been doing it a long time. But it's even more special when you come to an organization and you can really connect with it, and the people are great, and you see the good work that it's doing and how it serves its patients and its community as a result of that. So it's I won't say it's easy, but it's not hard.
Well, I'm always amazed that when I go into one of the Broward Health hospitals, excuse me, and there's so many things going on, and people walk in, people have no idea what it takes to run a hospital. What does it take?
Well, I think it takes great leadership. As you know, and it's been just announced recently in the paper, we will soon have a new president and CEO of the whole healthcare system, Dr. Elsinati, who has been around the system for a long, long time. He is the head of our emergency services that serves the entire healthcare system, so he's very knowledgeable about the system itself, about the hospitals, about the work we do, about the services we offer. So it's a wonderful transition to have someone from an internal candidate step forward and be willing to assume that level of responsibility. The sad part, of course, is that Frank Nask, who is a very dear and close personal friend of me, and as you know, is the reason that I actually came to Broward Health, is retiring. He's been there 8 years. He's been really the architect for what has become a very successful system financially and programmatically. Frank, because he is a CFO by nature, had such a great sense of the pulse of the organization and the needs to move forward in a very comprehensive way, was able to create a team that was able to really respond to where the organization was and help grow it moving forward. So Frank he leaves at the end of this year, although he'll still be around. He just won't be president and CEO. I think he's going to be of counsel for quite a long period of time, and it'll be a joy to have him in that capacity. But for me personally, I know Frank maybe 20 years, and I was a happy consultant before he contacted me and asked me to come down and help restructure the foundation. So it takes leadership. It takes that kind of leadership. It takes the ability to not only have the innate ability to lead, but to be smart enough to surround yourself with people who are as good, if not better, than you are in particular areas, and invest in them and their ability to make the right decisions and move an organization forward. So we're very fortunate from that perspective.
Dennis, a good man never retires. Yeah. He may get repotted. He may do something else. So he's going to be hanging around in some way.
He'll be around for a long time.
But I did have the pleasure of meeting Dr. Elsinati, and he, at one time, he was, of course, when I met him, he was handling the emergency center there, I think at Broward Health.
The old Broward General. Wasn't it Broward General referred? Maybe it was Broward Health.
No, maybe it was General. And, of course, I had never been through an emergency center. I thought, oh, do I want to see this? And it was huge.
Yeah.
I mean, there were so many rooms and so many people coming in. And
right.
See, people don't really know what goes on at a hospital.
Yeah, exactly. And, you have been actually such a wonderful asset for us, not only because you serve as a board member and you're very engaged in the life of the foundation, but you've been gracious enough to have the CEOs of all the hospitals on your show. So you've given us the opportunity through the CEOs of those hospitals to talk about what they do, to talk about how they serve the community, to talk about what their areas of specialization are and the kind of equipment we have, how we respond to the ongoing changes in the healthcare environment. So for us, having the ability to use this forum to communicate what we are and how we serve has been a true asset to us moving forward. All the CEOs, as you had them one after another here, really enjoyed their time with you and the opportunity to talk about what they do every day, which is to run big healthcare organizations. As we've talked about before, and speaking to your point, Broward Health is a huge healthcare system. We're one of the largest in the country, one of the 10 largest in the country. We have a net operating budget of excess of $1 billion a year. We did last year. We had 1.2 patient visits, 1.2 million patient visits. We have more than 8,000 employees. We have relationships with about 2,000 doctors. We have a huge economic impact. So one would, knowing as you do, if you look at our $1 billion net operating budget, our economic impact on the community is somewhere probably between $4 and $5 billion annually. So we're a big healthcare system, one of the largest employers in the whole county, and take great pride in what we do and how we do it, and how we are at the forefront of not only healthcare but in serving our patients who turn to us in their hour of need at the highest level. As you know, as a member of the foundation board, we have a number of projects going on in the foundation, and one of the ones that is probably the most prominent is our kids campaign, which is it's all about kids, a special campaign for Broward Health, and what it is. It's a $52 million project to renovate and expand our children's hospital at Broward Health Medical Center, which is the second phase of a two-phase program, $74 million program at Broward Health Medical Center to really respond in a better way to women's and children's services. The first part, again, as you know, was $22 million that was spent to renovate our maternity place. We now have all private rooms. In fact, we have 31 private rooms, and then we have 4 suites as well. And one would think, why would you do that? Well, you do it for a couple of reasons. Number one, we have, just as the basis of why we're doing the renovation of the Children's Hospital, we have some of the best doctors. We have the best nurses, great staff, great health care. What we don't have is the highest level of environment, facilities. So in the case of the maternity place, for those who wanted to have a child there, those rooms were semi-private rooms, or some of them were wards. So there's no privacy there. So one of the basic reasons for doing that was to provide a better environment for a woman who wanted to have a child. The second was that, as you can imagine, OBs were reluctant to refer their patients there because the quality of the facility was just not good. Now with this renovation, we've seen a significant increase in the number of births and birthing that has happened there. So that's the first part of it. The second part of it, which is the second part of this $74 million women's and children's expansion, is to renovate and expand our children's hospital. If you looked at the connection between the two, if you have a woman who has her child there, the natural transition, if that child needs pediatric care, would be to the Children's Hospital. So this renovation will enhance that relationship. It will change how we deliver care, from the sense that there will be better facilities, there will all be family patient-centered care, which is really premised around the concept of private rooms. The interaction between family and their doctors or the healthcare team, having the whole extended family play an integral part in the delivery of healthcare and how that healthcare is received by the child in this case. So what you'll see is, so you have that concept being integrated not only in the maternity place, but an expansion of that through what we plan to do in the Children's Hospital. So our NICU, which is currently all on one floor, we have 63 beds on one floor. It's a big ward, if you will, both level 2 and level 3. This renovation will move that from one floor to 2 floors, and all of the rooms will now be private rooms on those 2 floors. We'll have 27 level 3 beds and then 36 level 2 NICU beds that'll now be available. So the parents will be in a private environment. The healthcare team will come in, and for any woman who is, I've never experienced this firsthand, but I see it every day, for someone who has a child who is in crisis that needs to be placed in the NICU because they're, for whatever reason, when they're born, you can imagine that child is in crisis, and right next to you is another child that might code. Anything could happen. So you have you're already experiencing, you're experiencing such a very difficult time, a stressful time, and then something happens right next to you. So the idea of making these all private rooms is so that you be in your own private space. You'll be able to stay in that space. The medical team will come in as they do their rounds and talk to you. There won't be people around to hear what's going on. And you'll be able to focus on your child and not have to worry about what else is happening around you or how that exacerbates an already stressful situation. Same when you go onto the pediatric floors. Those will all now become private rooms. Each of the floors will have 22 private rooms. So and each of those rooms will be equipped, again, we're talking about patient family-centered care. So each of the rooms will have sleeping, whether they're beds or sofas, and the families can actually stay there the whole time. And it'll be private. It'll be their own little space, their own little world to really deal with the issues and to enhance the healing that will also result in. A child, as you can imagine, will heal better, or you'll get better in a space that's conducive to your doing that.
And that's a great explanation, but I have a special tender place in my heart because when I was, I guess I was 19, I had a child, and then I gave birth to one that was 2 pounds, 14 ounces. But my water had broken in my 5th month. So they put me into the hospital. This was down in Miami Beach. And I stayed in the labor room. Yeah. I couldn't move. They made me stay there. But the thing that happened is, here I am fighting to hold this baby, and the person next to me was a code blue, and she lost the baby. Yeah. So you're right. It was very difficult. I was a young person. Yeah. And then when my baby was born, of course, I didn't get to see him. He was in isolate. It was a different place. So I'm just thinking about what you just said. And my goodness, that would have been so wonderful for me.
Exactly. That's why hospitals are moving in that direction. Because, as you know, in today's world, especially in today, as we move forward with technology, the ability to save babies, infants, some are less than a pound. Some aren't as big as your hand. And to think that we now have the technology and the knowledge and the ability to deliver health care in such a way that those babies live and that they grow to be normal children, over a period of time. So we want to be able to ensure that when something like that happens, and it's an early birth or a preemie for some reason, that they have the ability to really be in their own space and to be in a private environment where when the health team comes in, they can talk directly and frankly with them and not have to worry about other people hearing what's going on or being exposed to what might be going on in the rest of the space.
So now that you heard all this, let's talk about raising funds. I want to talk about raising funds because you've had some wonderful people
Right.
step forward. We ought to talk about that. But if you're listening to this show and you haven't made your will out yet, or you have made your will, you can change your will. Wouldn't it be nice to think that after you're gone, you're living in perpetuity? I think it's a wonderful thing
Amen
to think.
to that. Yes,
Right. So we want to
exactly.
do that, right?
We do. We have a legacy society called the J.D. Camp Senior Society. For those of you who are listening to this and have been around for a long time, you might remember that J.D. Camp Senior was the individual. He and actually 5 other people were at the very forefront of bringing health care to Fort Lauderdale. They, in fact, raised the money in 1937 to build Broward General. They actually first acquired the old Granada Hotel and converted it, and then over a number of years raised all the funds to actually build 3 of the wings that are part of Broward General today. So, when you think about that, and the impact they've had on this community and how this community responds to the needs of the community, that, they set the tone for a couple different things. Number one was they wanted to make sure that the people of Fort Lauderdale, and now because Broward Health reaches so far, the people who turn to our system have the best facilities that they can access and the best state-of-the-art technology. So they were invested in that, and they really wanted to make sure the community had that. The other thing that they did that someone like me probably thinks more of than most people, that's the fact that they really set the tone for connecting philanthropy to facilities, or philanthropy to the needs of the community, because they aggressively raised all the money to do this, to create the first hospital, and then to build 3 additional wings to Broward General. So from those days, the mid-30s, this group of people stepped forward and really understood the importance of maintaining the public trust, being committed to the community, and the importance of philanthropy and the critical need that serves in responding to the needs of any community, whether it's healthcare or the Humane Society or Henderson or whatever it is. That philanthropy becomes a key element of making those connections, more than just the money that's contributed. It's about the relationship that happens between the individual and the mission of that organization, like you, Anita, being part of our foundation, embracing our mission, and feeling a sense of responsibility as a result of that to help us be successful, because our being successful lends to the organization responding to whatever's needed by the community. So from those early days, because of those things, we felt as we created our Legacy Society, which recognizes individuals who make plan gifts or estate plan gifts to our organization, we felt that, J.D. Camp Sr. was the ideal person to really permit us to recognize forever at the organization. And we talked just recently about an interesting estate gift that we just received, and I know Anita believes, as do I, that there is such a thing as fate. And this is all about fate. Essentially, in a nutshell, a man and his partner, there was a couple, and he left his estate to his partner. As it turns out, his partner predeceased him. So not too long after this happened, he was out walking his dog at night and got hit by a car. He ended up in Broward General. He and his partner had used Broward General for a long period of time. They were very close to the hospital. He ended up at Broward General, and the reason he had left his assets to his partner was that his family, which is his mother and siblings, were not accepting of his lifestyle. So he didn't want to leave anything to them. But on his deathbed, he made the decision to leave the money to his mother and then to 3 charities. Actually, it was his partner and 3 charities predeceased him. So now he makes a decision on his deathbed to leave his assets, his estate, to his mom, and then upon her death to these 3 charities. 16 years later, this year, the mother dies and really has never had a need for much of that money. So she's not really accessed the money that she had the ability to do. So she dies. And the executor of the state then, the normal transition would be that the money would then go to these three charities. Well, they begin to look for these three charities. It turns out they don't exist. And they were never registered in the state of Florida. So now the court doesn't know what to do with the assets because all of the beneficiaries have died, and then the ultimate beneficiary, remainder men, were these three charities. They don't exist. So a long process happens. They ultimately come to our foundation because of all the things that they hear the foundation is doing. And the short of it is we go to court and present to the judge. The executor or the trustee of the estate agrees that we're probably the best place to do that. So in talking to the trustee, we agree that we're going to set up an endowment to recognize this gentleman. And his name was M.D. Smith, and they called him Doc Smith because M.D. were his two initials. So she agrees, the trustee agrees to this, think that's a wonderful thing. So I set up an endowment. We go to court, the court approves it, and then we find out what the assets are that's in this estate. It turns out to be $430,000. So, as I said, I'm a huge believer in faith. So when you think about all the steps that gift went through to get to us, one, if you believe in fate, you have to believe that from the very beginning, that's what was supposed to end up. So that's another example of how the organization, in serving the community and building its reputation and being well received in the community, ends up the recipient of something like that. And it fits into the J.D. Camp Society.
That's what I wanted to ask. So it goes into the J.D. Camp Senior Society. Then how? So if someone wants to actually fill out the form that's in Boomer Times, if you're looking at the December issue, you go to page 24. There's a form there you can cut out and send in. Now, you don't have to worry about anything. Just send it in, and someone will contact you. Maybe Dennis.
I will contact you.
Oh, you are going to be so lucky. You're going to be so lucky. So Dennis will contact you because there are a lot of opportunities. Maybe you don't have that much money, but maybe you have a lot of money.
Right.
And why not do this while you can and really while you're living so you can enjoy what you've done, right?
Yeah, and I always make this offer. And I like to use the J.D. Camp Society as kind of a springboard to do that. But, I'm willing to talk to people about the importance of estate planning. And we can't obviously offer legal advice. That has to come from an attorney. But what I like to do is just sit down with individuals and talk about the options from an estate planning perspective. And from my perspective, to be really honest with you, I see it as my charge, if you will, to help people better understand that. And if they choose to support us that way, that's fine. If they choose to support another charity, that's fine. I just think that, when you think about that, I think the figure is 60% of the people who die intestate, which means they die without a will. And if you die without a will, there's a progression in every state that the money has to go through to where it goes. So, you need to be in charge of your own destiny, whether you have few assets or a lot of assets. But one of the things we all need to do is to make sure that upon our death, that whatever our assets are, they go exactly where we want them to go, to whomever it is that we want them to go to. So we need to be in charge of that. And so many people don't have wills or don't take the time to really look at an estate planning idea or sit down and talk to an attorney. Because one of the reasons that happens, Anita, as I'm sure you can appreciate, is that many people stay away from writing a will. Because why do you think that is?
Well, that's because they don't think they're going to die.
It makes them deal with their own mortality. So it becomes a reason that people don't want to do that. But you need to do that. And there's so you can actually in many states You can handwrite a will. You don't even need to have an attorney. And you can go online, and there's lots of, for nothing. You go online, and it gives you a format of what ought to be in your will, and you can fill it out and then have it, notarized. There's lots of things that you could do, but you really ought to be in charge of your own estate and how you want your estate to be distributed upon your death.
Well, in the ad that you ran in the November issue, the Income for Life, the charitable gift annuity, that's fascinating. I think we might have a little time for you to talk about that.
Yeah, that's great. The charitable gift annuity, the key, again, is as long as the organization that you're thinking about, the charity, is able to issue charitable gift annuities, it's probably, of all the estate planning gifts, all the plan gifts, it's the easiest one, separate from writing your own will, to really engage in. And the reason for that is it's the only agreement, it's the only what's called life income vehicle. It's called a life income vehicle because it distributes to you, and in the case of a charitable gift annuity, 1 or 2 lives, income for as long as you live. So they're called life income vehicles. But the charitable gift annuity, what makes it so attractive is it doesn't involve an attorney. It's a simple agreement between the organization and the individual. And if your charity that you are supporting issues charitable gift annuity, most permit you to really write a charitable gift annuity for $10,000. There's a whole charitable contribution that goes along with that. There's an annual distribution that comes to you based on your age. So it's a kind of vehicle that if people are if someone wants to support an organization and has included them in their will, for example, and has no need, is not and doesn't really have a need for that income right now, you should fund one of these life income plans because you're going to that money. You want that money to go there anyway, and you might as well take advantage of the tax laws as well as the income stream that will be coming to you during your lifetime.
Yeah, I think it's a great thing. And let me give you a phone number to call. It's 954-712-3980. That's 954-712-3980. This is the new year coming up, 2015. Do it. It's Broward Health Foundation, the power of one gift. All you have to do is walk into one of their hospitals and know that things are really working so well. Thank you, Dennis, so much.
Thank you. It's always a pleasure to be with you, Anita.